Okay, let's dive into a topic that is incredibly complex and, frankly, quite polarizing. Morgellons disease. Imagine experiencing strange skin lesions, feeling like something is crawling or stinging you constantly, and seeing what look like unusual fibers coming out of your skin. That's really the core of the mystery we're exploring today.
And what makes this so challenging, is the deep divide in understanding it. One perspective suggests it's a somatic illness, meaning it has a physical, biological cause, maybe linked to an infection. The other view, which is, well, more widely accepted in traditional medical circles, is that it's a manifestation of delusional parasitosis.
A psychiatric condition, right,
Yeah,
where someone strongly believes they're infested, but it's considered a false belief.
exactly.
So for this deep dive, you provided us with, well, quite a stack of material articles, research papers, even personal notes digging into everything from its origins, the
Well,
treatment.
who seems most affected, yeah.
Right.
Our mission today is really to unpack all of that. We want to pull out the most important insights, maybe some surprising facts, and definitely the conflicting viewpoints, just to help you, the listener, get a handle on the different facets of this really puzzling condition.
Okay, let's get into it then.
Let's do it.
So where did this mysterious condition even come from? The material you shared points to a really interesting historical echo, doesn't it?
Absolutely. It turns out the term Morgellons isn't actually new. Not at all. It dates way back to 1674.
Wow, 1674.
Yeah, an English physician, Sir Thomas Browne. He described a condition in children where thick hairs seem to erupt from their skin. Now, it's a brief mention, maybe a bit vague, of a historical footnote, really, but that's where the name originates.
That's fascinating, taking it back that far. But the modern story, the one most people know, that really kicks off much, much later, 2002.
That's right, 2002. This is where we meet Mary Leitow. She was a lab technician, and she noticed these, well, what she described as colored fibers coming out of a sore on her 2-year-old son's lip.
And the doctors were dismissive.
Pretty much, yeah. According to her account, they dismissed her observations, so she felt she had to do something. She actually coined the name Morgellons for her son's condition, specifically linking it back to that Sir Thomas Browne mentioned. And she founded the Morgellons Research Foundation, the MRF, to push for recognition and more study.
And that advocacy started to gain some traction.
It did. It really started building momentum. You had researchers like pharmacology professor Randy Wymore starting to look into it, often, against some initial skepticism. This whole patient-led movement, kind of fueled by public pressure and lobbying efforts, it eventually led to the U.S. Centers for Disease Control and Prevention, the CDC, launching an investigation.
When was that?
That started in 2006.
Okay, so years of investigation. What was the big finding? What did the official CDC study conclude?
Well, the CDC worked with Kaiser Permanente up in Northern California. They looked at 115 people who reported having Morgellons symptoms. Their study, which came out in 2012, basically concluded that the symptoms were, and I'm quoting loosely here, similar to those of delusional infestation.
Delusional infestation again.
Right. And they also reported that the fibers they collected from people's skin were primarily from common textiles.
Like cotton.
Exactly, like cotton or nylon, things like that. Not something being produced biologically by the body.
Okay, that sounds, pretty definitive coming from the CDC, but I'm guessing the material you shared didn't just leave it there. Were there critiques?
Oh, absolutely. Yes, that conclusion is a huge point of contention. Critics really question the methodology. They argue that focusing on a specific group within the Kaiser system who self-reported, well, that might not represent everyone who experiences these symptoms.
So maybe a biased sample.
Potentially, yeah. And crucially, they question the fiber analysis itself, especially when you consider the patient reports describing fibers that just don't seem to match clothing or common household materials.
So sticking with origins, beyond the psychiatric angle, what about other ideas? Did the sources mention alternatives?
Yes, definitely. A really significant thread in the research you provided explores a potential link to infections, specifically spirochetal bacteria.
Like Lyme disease.
Exactly, like Borrelia burgdorferi, the bacteria that causes Lyme. Now, some of this gets pretty speculative. There's even research mentioned that tries to draw a possible line back to historical cases, like Ötzi.
The Iceman, the mummy.
Yeah, that 5,300-year-old mummy. They found evidence of Borrelia in him. So some researchers connect those dots, speculatively, of course.
It really feels like there's this stark contrast. You have the official view leaning heavily towards psychiatric,
Right.
and then these alternative theories about physical causes like infections.
That tension is the Morgellons debate, really. It's at the heart of it. You have the medical establishment often landing on the idea of a psychiatric delusion causing the sensations, the skin picking, all of it. But then you have patients, and they're reporting persistent, sometimes really debilitating physical symptoms. And they describe these unusual fibers they truly believe are real and biological. So the material makes it very clear. The origin is still unresolved, and you really have to approach any single explanation with a healthy dose of skepticism.
Okay, so if the cause is so up in the air, how on earth is this condition treated? It sounds incredibly complicated.
It is, yeah, it's very complicated. The treatment approaches you see vary dramatically, and that's simply because there's no consensus on what's actually causing it.
So it depends on whether the doctor thinks it's physical or psychiatric.
Precisely. That perspective dictates the course of action. And there are no standardized treatment guidelines. None. It really creates a landscape that just demands highly individualized care.
Okay, so for those who lean towards an infection being involved, what treatments are explored in the material?
Right, so the possibility of that infectious link leads some doctors, and certainly many patients, to explore antibiotic therapy, especially if there's a suspected connection to Lyme or maybe other pathogens. Some studies, like one mentions from 2015, where they reportedly found Borrelia in skin samples from, I think, 25 patients.
Right.
That kind of finding fuels the discussion about using antimicrobials. See mentions of extending courses of antibiotics, like tetracycline or doxycycline.
But does it work consistently?
Well, the material suggests that consistent definitive cures haven't really emerged from that approach alone. And there's also talk, especially in patient communities online, about potential co-infections.
Other things besides Lyme.
Yeah, other tick-borne illnesses like
Yeah.
Babesia or Bartonella. And that leads some people to explore antiparasitic drugs like ivermectin or even antifungals.
But are these treatments, the ones targeting infections, are they actually proven effective for Morgellons specifically?
The research we looked at is very clear on this point. Without rigorous clinical trials designed for Morgellons, their effectiveness remains unproven for this condition. And the material also flags the potential risks. Using powerful drugs like long-term antibiotics for unconfirmed infections carries risks, side effects, for one.
And antibiotic resistance, I imagine.
Exactly. That's a major public health concern.
Okay, so what about the other side? The approach that aligns more with the CDC's stance, treating it as, well, a belief-based disorder.
Right. That perspective logically leads to recommending psychiatric interventions. Antipsychotic medications, things like risperidone or olanzapine, are commonly prescribed. The goal there is to manage the belief component, the fixed idea of infestation. And there are some reports suggesting these can be effective, at least in reducing behaviors like skin picking, which can certainly make the physical symptoms worse.
Does it always work?
Not necessarily. There's a case study mentioned, an adult woman with severe skin lesions. She got initial antipsychotic treatment, but then she was lost to follow-up. And the material suggests this is kind of a pattern. Many patients are reluctant, understandably perhaps, to accept a purely psychiatric diagnosis when their experience feels so overwhelmingly physical.
So doctors might recommend a team approach. Psychiatrists involved.
Yes, dermatologists often suggest that, bringing in mental health professionals. But as the material points out, this can sometimes strain the doctor-patient relationship. If the patient feels like their physical symptoms are just being dismissed as all in their head, that trust can break down.
Are there other ways people try to cope? Maybe things outside of traditional medicine?
Yes, absolutely. The sources mention supportive care, things just aimed at managing the skin itself, basic wound care, maybe using topical antibiotics or steroids to help the lesions heal. Though slow healing is apparently a common frustration. And then, especially in those online patient communities, you see a lot about alternative therapies.
Like what?
Things like specific dietary changes, various detox protocols, natural remedies like colloidal silver, a whole range of things. But it's really important to stress, as the material does, that these generally lack solid scientific backing. And some could even pose their own risks.
So it sounds like the relationship with the doctor is key, regardless of the approach.
That seems to be a crucial takeaway. One study from 2018 really emphasized this. It suggested that treatment success, whatever the method, seems to rely heavily on building a strong, trusting rapport between the patient and the provider, which points towards needing a more holistic approach, right? One that acknowledges and addresses both the physical symptoms and the huge psychological toll this condition takes.
And critics of the dominant psychiatric view argue that this focus might be blocking other research avenues.
Exactly. That's a common criticism you see in the sources. The argument is that by focusing so heavily on psychiatric treatments, we might be overlooking potential biological or infectious causes that need investigation. The suggestion is we need more research into, say, immune system function in these patients, or a much more detailed analysis of the fibers themselves.
Revisiting those findings of keratin and collagen you mentioned earlier.
Precisely. The idea is that digging deeper there might uncover underlying mechanisms that could actually lead to more targeted and effective solutions down the road.
Let's shift gears slightly. Did the material reveal anything about who seems to be most affected? Are there specific groups that appear more vulnerable to Morgellons?
Yes, it did. And the demographic patterns described are quite interesting. They actually challenge, to some extent, the idea that this is purely a psychological issue.
Okay, so who is the most commonly reported group?
Overwhelmingly, the data points to middle-aged women. Studies consistently show a mean age somewhere around 55 and a really significant female predominance.
Do we know why?
Not definitively. The CDC's 2012 study confirmed that skew towards women, finding about 3.65 cases per 100,000 people, mostly women. Possible reasons mentioned include things like women maybe being more likely to seek health care or perhaps hormonal factors, but it's not fully understood.
And do they just have the skin symptoms?
Often not. This group frequently reports other symptoms too, things like chronic fatigue, joint pain, sometimes cognitive difficulties, and depression, which of course can overlap with lots of other chronic conditions, making diagnosis even trickier.
You mentioned geography earlier, too.
Right. There seems to be a higher prevalence reported in certain states. California, Texas, Florida come up. Some researchers see this pattern, often in warmer climates where ticks are more common, as potential support for environmental or infectious triggers. But again,
Correlation isn't causation.
exactly, it's an association, not proof.
What about people who already have mental health conditions? The sources mentioned a link there, didn't they?
They did, yes. Individuals with pre-existing psychiatric conditions are discussed as potentially vulnerable. One case series from 2009 is cited, where 23 out of 25 patients studied had prior diagnoses like bipolar disorder or OCD.
Okay, so that seems to support the psychiatric angle.
Well, yes and no, because the material adds a really critical counterpoint. Apparently, when they look closely at the medical records in many of these cases, the physical skin symptoms often started before the psychiatric diagnosis, or they started around the same time.
Ah, so the timing is key.
It raises a really important question. Could the mental health struggles be developing in response to dealing with this chronic, bizarre, and often dismissed physical illness, rather than being the root cause of the physical symptoms?
That flips the narrative, potentially.
It does. And the sources also touch on social isolation, which can be common for people with chronic or stigmatized conditions. It might increase vulnerability because, well, maybe they have less support.
Less access to traditional help.
Right, fewer people in their daily lives to talk to or get support from, which might lead them to rely more heavily on online communities. And while those can be lifelines, they can also sometimes reinforce self-diagnoses based more on shared stories than, rigorous medical assessment.
And the tick-borne disease connection pops up again here, in terms of vulnerable groups.
It absolutely does. The material really reinforces this link. People with known exposure to tick-borne illnesses, particularly Lyme disease, seem to be at higher risk. One study looked at 1,000 Lyme-positive patients. 6% of them were subsequently diagnosed with Morgellons, which is, higher than the general population rate. And what's really striking is the high rate of co-infections found in many Morgellons patients who also have tick exposure.
So, not just Lyme, but other things carried by ticks.
Yeah, things like Babesia or Ehrlichia. One dataset mentioned found these in 77% of cases studied. This suggests there might be something going on with immune system dysregulation, perhaps triggered by multiple infections.
Does that link to other immune issues, too?
Potentially. The sources also mention individuals with known autoimmune conditions, like Hashimoto's thyroiditis. One study found this in 32% of their Morgellons cases, suggesting maybe a broader susceptibility linked to immune function. So you add that to geographic factors living in tick-prone areas, maybe lots of outdoor activity, and you see a cluster of risk factors emerging for this group.
It makes you wonder if the official numbers, like from the CDC, are accurate.
That's a point raised in the material, too. The suggestion is that the CDC rate might be an underestimate. Partly because if people have had their symptoms dismissed early on, they might just stop seeking medical care altogether, so they wouldn't be counted.
So it's mainly middle-aged women, people with mental health history, people with tick exposure. Are children or the elderly completely unaffected?
Less commonly reported, for sure, but definitely not immune. We have Mary Latao's son, the very first modern case, who was a child. And the material mentions rare cases in older adults, too. There was one example of a 63-year-old man who'd apparently had symptoms for 15 years, so it can span different age groups.
And I guess people with limited access to healthcare are vulnerable too.
That's implied, yeah. If you can't easily see a doctor or afford ongoing care, you might be more likely to self-treat based on, well, whatever you can find online, which isn't always reliable or safe. So overall, these demographic patterns, they really do seem to challenge the idea that this is just delusional parasitosis. They push us back towards reconsidering those environmental and infectious hypotheses more seriously.
Okay, so we've looked at the strange history, the really intense debate over origins and treatments, and these patterns and who gets affected. Thinking about the bigger picture, what are the main implications or takeaways from all the material you reviewed for us?
Well, I think one of the biggest takeaways is how this whole Morgellons controversy really shines a light on a fundamental tension in medicine. It's about the difficulty in reconciling deeply felt, subjective patient experiences with institutional medical frameworks and often limited objective measurable findings.
And the critique of the CDC study's conclusion seems central to that.
It really is. That finding, primarily cotton fibers, is seen by many patients and some researchers as fundamentally dismissing their lived experience, especially when compared to independent studies reporting findings like keratin and collagen, which are biological proteins. The concern raised in the material is that this kind of dismissal, however unintentional, might shut down important avenues of research into potential biological causes.
Leaving people potentially stuck without answers or effective help.
Exactly. And it potentially leaves a vulnerable population without adequate support or validation. And given the recurring association with Lyme and other tick-borne illnesses,
Yeah.
the material suggests there might be a missed opportunity to really explore those zoonotic links more deeply, especially in areas where ticks and these diseases are common.
The internet seems to play such a huge, maybe complicated role in all this, doesn't it?
Oh, absolutely. The material describes it as a real double-edged sword. On one hand, it's a vital space. For patients who feel isolated or dismissed by doctors, it's a place to connect, share, raise awareness.
That's where you see the advocacy for infection theories, right?
Yes, and for treatments like antibiotics or antiparasitics. But on the other hand, the material warns that these online spaces can also amplify misinformation. You find unproven, sometimes pretty wild theories circulating. Things about nanobots or biological warfare agents are mentioned as examples found online, and these lack any real scientific validation.
And the medical community's reluctance to fully engage, that has consequences too.
The material suggests it does. While doctors might hesitate because they want to maintain scientific rigor, that hesitation can unfortunately lead to patients feeling even more isolated and distressed. And we can't forget the impact. Many individuals reporting these symptoms describe significant declines in their quality of life, affecting work, relationships, everything.
Wow. Okay. We've really gone deep into the material you shared on Morgellons disease. From that surprising historical note
Yes, Sir Thomas Brown.
to the modern controversy, the conflicting ideas about what causes it, how to treat it, and the specific groups of people who seem most affected.
Yeah, and just to quickly recap the key findings for the sources we covered, Morgellons is still very much a medical enigma. It has these strange potential roots centuries ago, but reemerged strongly in the 21st century. Treatment options are really divided, reflecting that fundamental split between the infectious disease view and the psychiatric view. And the patterns we see in who gets it, like middle-aged women, people with immune issues, those exposed to ticks, they seem to challenge a purely psychological label. And some independent research keeps pointing towards a possible infectious link that, according to the sources, really deserves more investigation.
This deep dive certainly paints a picture of a condition where, patient experience and current scientific understanding are still really struggling to find common ground.
Absolutely. And the material really emphasizes the need for caution, advising against jumping to one simple diagnosis. Instead, it advocates for a more balanced perspective, one that genuinely tries to integrate what patients are reporting with rigorous but also open-minded scientific inquiry.
So, as you, our listener, process all this information thinking about the history, the intensity of the debate, the very real experiences described.
Maybe consider this final thought. When you look at those specific groups who seem disproportionately affected, like middle-aged women or people with a history of tick-borne illness, and you factor in the persistent reports, plus those independent findings of fibers that aren't just cotton, Does the dominant medical narrative, the one leaning heavily on delusional infestation, fully capture the reality for the people living with this condition? Or, as the sources seem to suggest, is there still a crucial piece of this puzzle missing that more research really needs to uncover?